If we fail to cope, if we're saddled with the burden of guilt for not having made more of ourselves, wouldn't we welcome the professional opinion of a therapist with a diploma on the wall, that it's not our fault, that we're off the hook, that absent or violent fathers, or resentful and manipulative mothers, or genetics, or sexual abusers, or Satanists, or testosterone, or aliens are the responsible parties? Wouldn't we be willing to pay good money for this reassurance? Wouldn't we resist smart-ass skeptics telling us that it's all in our heads, or that it's been implanted by the very therapists who made us happier about ourselves? How much training in scientific method and skeptical scrutiny, in statistics and human fallibility have these therapists received? Psychoanalysis is not a very self-critical profession. Most mental health professionals in Britain are most likely to be social workers than either psychiatrists or PhD psychologists, with all of them having to contend with their responsibility to support their patients, not to question or to be skeptical or to raise doubts, which is very naive, especially when in many of these cases there are financial rewards for deliberately tricking therapists into a false diagnosis, whether by receiving government funding, being deemed unable to work, or looking after yourself. Think for a minute in the financial relationships between therapist and patient, and about how much the patient and the therapist know about each other before a single word is spoken. Therapists have the obvious interests of prolonged therapy, and some patients have the financial interests of receiving government allowances, subsidies, accommodation, sometimes even insurance compensations, and being liberated from the mundane burden of looking after themselves. In this paradigm, how likely is the therapist to offend patients by evincing some skepticism about their stories? How aware are they of the dilemma of a naive patient walking into a professional office and being told that the fatigue, the insomnia, the obesity, the apathy, and other ailments in increasing order of outlandishness are to be attributed to wholly forgotten parental abuse and neglect, maybe even satanic rituals or alien abductions? The evangelical self-esteem campaign has been a powerful influence encouraging the identification of mental health issues. Equally, if not more important, in spreading the idea of mental illnesses in Britain are the specialists, American and British. They may have few or no qualifications as professionals, but attribute their expertise to experience of cases. Those convinced that mental illnesses represent a serious danger to our society tend to be impatient with skeptics. But when you hold modern mental health practices to rigorous scrutiny, it always seems to require tacit cooperation between the patient and the therapist, an abandonment of skepticism, or what sometimes is described as the willing suspension of disbelief. It immediately follows that, to penetrate the magic, to expose the trick, we must cease collaboration. In all classes of recovered memories, there are specialists. There are women's issues specialists, sexual assault specialists, work environment specialists, and specialists in recalling repressed memories of childhood sexual abuse. As is common in mental health practices, patients select or are referred to a therapist whose speciality seems relevant to their complaints. In all cases, therapists help to draw forth images of events alleged to have occurred long ago, in some cases decades ago. Therapists are profoundly moved by the unmistakable, genuine agony of their patients. In parallel to regressing people so they supposedly retrieve forgotten memories of past events, even of past lives sometimes, therapists seem to readily progress people under hypnosis so that they can remember future lives. This elicits the same kind of emotional intensity as in regression hypnosis. These patients are not out to deceive themselves. They simply cannot distinguish their confabulations with their experiences. Also, most therapists are known to ask leading questions, which are virtually orders by authority figures to suggestible patients insisting that they remember. Maybe even the appropriate word would be confess. This critique doesn't mean I don't sympathize with people that are going through depression and that This critique doesn't mean that I don't sympathize with people that are going through depression, that are struggling with anxiety. I have struggled with depression and anxiety since I was 18 years old. I have been medicated for years. I've gone to therapy for years. And some of it's helped, some of it hasn't. So in the next episode, I'm going to be giving some advice on what's worked for me. And it's going to be a more positive view on therapy. Because like most things, it's a double-edged sword. There's some good things and there's some very bad things. On the next episode, we're going to talk about what's worked for me dealing with depression and anxiety, and I hope you show up to see that episode.